If you're thinking of coming into psychiatry, I think the first thing you need to think about is, do you have a passion for wanting to care for patients' mental health? Is it something you think you can do long term? Also, I would probably ask, if not psychiatry, what else did you want to do? Just psychiatry. If not psychiatry, psychiatry again. Honestly, I enjoy psychiatry. I love them. If you're thinking of coming here, I would say it's a very wonderful place to do your training in the Northeast. We have a wide range of patient groups that we see. In TWIV, we've got like different services. We've got services for children, services for adults, services for older people, and we've got also services for the learning disability population as well. So having that like wide range of services that we offer to the population in the Northeast is really beautiful, and having to work with different age group, I think, is quite beneficial for me as a psychiatrist to get that experience. Unlike working in the acute hospitals where, you know, you've got really acutely unwell patients and you need to make decisions like now, this is a bit more like not that intense. So it gives me time to, like, you know, look into the patient record, have a conversation with these patients, make decisions not just to change medication, but see how this can change a patient's life and make their life better. I think that kind of like gives me more fulfillment than just having contact with the patient for 3 days in an acute hospital, because you've got time to work with our patients and improve the quality of care, and you're seeing that, oh, what you're doing is actually helping the patient's life. And you know, when you get those little notes like, oh, thank you for this, thank you for that, it's kind of like, oh, I'm actually doing something important and I'm actually impacting into the society. So I feel that gives me quite a lot of fulfillment as a doctor. I feel like the Northeast is actually a very beautiful place to do your training. I'm very glad I came here. I've learned a lot whilst training here, and I've got lots of opportunities to like do other things besides clinical work, which I feel has really been helpful in the course of my training. And I feel like this area has got that scope that's available for you to like expand on your knowledge and skills to make you a better doctor. What do I do in my spare time? I would say it's kind of like a mix of different things, to be honest. The Northeast is quite very beautiful. We've got Darlington, which is where I live, which is really beautiful. Yeah, I would advise you to visit if you want. We've got Newcastle in the Northeast, which is amazing, and it's home to Newcastle United. There's a lot of restaurants to have good food with friends, and a lot of places to like hang out with friends if you're feeling like the need to go out. We've got Durham, which is very, 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 very amazing. We've got nice beaches in the Northeast, if you want to visit with friends and family, and we've got some holiday resorts as well. So it's quite a big trust, and I think that's the unique thing about the Northeast. It's big, it's wide, there are lots of amazing places to go to and amazing places to hang out during the weekends. I'm confident that if you come to the Northeast and North Cumbria, you will find your place here.